Hello, and welcome to the 2027 Policy Advocacy Funding Opportunity webinar. Caring for Colorado utilizes a one-part online application process for this funding opportunity. The application is designed to provide grant seekers with an opportunity to share information about the organization and the proposed policy advocacy work. Staff review applications to determine eligibility and alignment with our public policy advocacy funding priority. And this webinar is focused on submitting your application for the 2027 Policy Advocacy Funding Opportunity. The purpose of this webinar is to introduce you to the policy advocacy team, review focus area and funding strategies, explain how to access and submit your application in Flux, our online grants portal, and to ensure you have everything you need to submit your application. The public policy advocacy team is comprised of Jeff and me. Our team is led by Melanie, Senior Vice President of Philanthropy for Caring for Colorado. This top row is the external facing team you'll have the opportunity to meet with to discuss your organization's fit for the funding opportunity. And then we also have Emma and Karen, who work together as our small yet mighty grants management team to help ensure this process is as seamless as possible for applicants and ultimately grantees. Now we're going to move into the details of the funding opportunity, beginning with our purpose statement. The purpose of Caring for Colorado's public policy advocacy funding priority is to influence systems, policies, and practices that create generational change for young people and their families, particularly those ages 9 to 25 facing the greatest barriers to opportunity, through well-designed, adequately funded, and equitable public policy advocacy. Here are the three focus areas for the public policy advocacy funding opportunity. The first is to defend, secure, and expand the financing of safety net services, specifically Medicaid, the Child Health Plan Plus, otherwise known as CHIP Plus, Title X, and SNAP for young people and their families. And the desired result is to defend, secure, and/or expand funding to maintain essential safety net services, specifically Medicaid, CHIP Plus, Title X, and SNAP for young people and their families who live on low incomes. The second is to develop and pass local tax initiatives that support access to youth physical and mental health services. The desired result is to enhance community-level funding for youth physical and behavioral health by developing and passing local or regional tax initiatives. And finally, our third focus area is to promote and defend sexual and reproductive health and rights for young people in Colorado. The desired result is to advance sexual and reproductive health and rights for young people in Colorado through advocacy, policy development, and implementation. For this focus area, there are four strategies. The first is to protect and sustain the financing and provision of reproductive health services, including through Title X, Medicaid, and other public funding streams that support access for young people and their families. The second is to defend and expand health coverage and access for young people, regardless of immigration status. Third, mitigate the harmful effects of federal or state eligibility restrictions, work requirements, or administrative barriers in Medicaid, SNAP, and related safety net programs, with a focus on preventing young people and families from losing coverage, benefits, or access to essential services. The last is to advance solutions that address and contribute to remedying Colorado's budget crisis with a specific focus on solutions for young people ages 9 to 25. Grant funding types may either be general operating or program project. Applicants may request funding for 12 months. Grant awards range from $50,000 to $100,000 for statewide strategies. Approaches that employ multiple eligible tactics will be given stronger consideration. Eligible tactics include analysis, coalition work, policy development and implementation, polling, advocacy, and organizing. You can review our funding opportunity document for examples of what we might fund in this focus area. Please note, we will not fund individual political candidates, political action committees, and national policy advocacy. The next focus area, develop and pass local tax initiatives that support access to youth physical and mental health services, has two strategies. The first is to develop and work to pass local or regional tax initiatives that explicitly focus on positively impacting young people's access to mental, physical, and sexual and reproductive health services. And the second is to implement approved local tax measures focused on the health of young people ages 9 to 25 by supporting the effective implementation of voter-approved local tax initiatives. Grant funding types may either be general operating or program project, and applicants may request funding for 12 months. Grant award ranges from $25,000 to $50,000 for statewide strategies. Approaches that employ multiple tactics will be given stronger consideration. Eligible tactics include research, analysis, polling, strategy development, coalition building, and public messaging to advance local tax initiatives. Implementation tactics may include planning, stakeholder engagement, awareness campaigns, and rulemaking. You can review our funding opportunity document for examples of what we might fund in this focus area. And again, please note, we will not fund individual political candidates, political action committees, and national policy advocacy. And finally, our last focus area is to promote and defend sexual and reproductive health and rights for young people in Colorado. The first strategy is to support implementation of Colorado's comprehensive human sexuality education law, ensuring full implementation within school districts through parent and school board education, teacher training, narrative change, and amplifying youth voices. The second is to advocate to school board and local communities to promote access to sexual reproductive health services within school-based health centers, as well as the importance of funding school-based health centers or school-linked programs through the use of strategic advocacy and youth leadership. Grant funding types may either be general operating or program project, and applicants may request funding for 12 months. Grant awards range from $25,000 to $100,000, with larger amounts intended for regional or statewide strategies. Approaches that employ multiple eligible tactics will be given stronger consideration. Eligible tactics include advocacy, research, analysis, strategy development, stakeholder engagement, community education, school district policy adoption, coalition building, and public messaging. Again, you can review our funding opportunity document for examples of what we might fund in this focus area. Please note, we will not fund direct service programs, i.e. sex ed curriculum delivery and school-based health centers, for example, are funded under the Youth Health and Wellbeing funding opportunity. We'll be hosting optional virtual office hours to answer any of your questions about this funding opportunity and help assess fit. Before you schedule an office hour, please be sure to review the documents on our Public Policy Advocacy webpage. Most importantly, the Public Policy Advocacy Funding Opportunity Resource document, as this will help you decide which focus areas most strongly align with your organization's core work and will help us have the most productive conversation. To schedule, you can find the Calendly links for each team member in the Public Policy Advocacy Funding Opportunity Resource document. During office hours, we typically use a traffic light color system to help organizations figure out if they should invest time in submitting an application. Green means you're eligible and have strong strategy alignment. It does not mean you will get funded, but rather we would really like to see an application from you. Yellow means you're unlikely to receive funding, and there may be questions about your eligibility and/or weak strategy alignment. And red means you're ineligible and/or don't have strategy alignment. We recommend that these organizations that don't spend their limited capacity on completing the Caring for Colorado application. We look forward to connecting with you and everyone working in this ecosystem. Now let's talk about your application. We'll just briefly touch on the steps, and we'll share more about the steps to walk you through this process. The first step is to review the Public Policy Advocacy Funding Opportunity document. Second, click the application link on our website or in the funding opportunity document. You can then log into the online grants portal. You may already have an account if you've previously applied for funding for Caring for Colorado. If you are a new applicant, you must register, and you must register in Flux to complete an application. But the good news is you can save your work in Flux as you go. Please note, our grants management team will have to create an account after new applicants register. This is a manual process, and we recommend that you register at least 2 days before the deadline so there's enough time for us to create the account and for you to complete the application. We strongly recommend that you use Google Chrome as your browser, as it will greatly improve your experience. Once you're logged in, click the blue Apply Now button. It can be found in the gray menu at the bottom left of the screen. Once you're in, you can begin drafting your application. You'll have to select your focus area and at least one corresponding eligible strategy. Remember, for each strategy you select, you'll be required to determine at least one objective. So only select the strategy or strategies that are central to your core work and that you want to report on for this grant, not everything your org does. Once you click Submit, you'll see a general submission confirmation page. Finally, within 1 business day, you'll receive an email acknowledging receipt of Part 1 submission. I know you may want an immediate confirmation of submission, but please wait 1 to 2 business days. Please do not email grants management asking for immediate confirmation of submission. If you don't hear anything in 1 to 2 days, then you can reach out. Next, I'll plan to walk you through the specific steps to register and submit your application in Flux. To get started, first go to Caring for Colorado's grant portal at the website listed above. Log into the portal with your username and password. If you're a current or former grantee, you can use your current login information. If you're a new applicant, you can create a Flux account by selecting the Create Account Now button. After you fill out and submit the new account registration form, you'll receive an email within 3 business days with instructions to create a password and sign in. Once logged into the portal, click on the blue Apply Now button on the bottom left side of the portal to begin your application. You may save your work on your application at another time. To access your draft application, click on Draft Requests to access your current application. When you go back to edit your draft application, look for the Edit button in the upper right-hand corner after you select it from the list of your draft applications. For the policy advocacy funding opportunity, you will select one of the 3 focus areas. After selecting a focus area, you will be prompted to select the strategies your application will focus on. We encourage you to select no more than 2 strategies that most align with your organization's core work or that meet an emerging need in your community. The number of strategies selected does not affect the likelihood of receiving funding. Select only the strategies for which you plan to report on if your application is funded. The online form saves all strategies selected. If you change focus areas, please remove any strategies from the previous focus area by selecting No to the selected strategies before switching focus areas in the dropdown. Once you've completed your application, first click Save and Close. The portal will take you out of edit mode, where you'll have the opportunity to review your application before submitting. When you're ready to submit, please click the green Submit button at the bottom right-hand corner of your screen. You will not be able to edit your application after you click Submit. Here are just some other tips. As I mentioned earlier, the Flux system works best in Google Chrome. Please save your work. The portal logs users out after 15 minutes of inactivity, so save your work as you complete the application. The Save and Submit buttons are both on the bottom right-hand corner of the application. To add additional users for your organization, fill out the registration form on the Flux homepage. If you forget your password, use the Forget Password link on the Flux homepage to reset it. Thank you for watching this webinar. If you have any technical questions or need assistance, this is the email for our grants management team and their phone number. And before we end the webinar, I just want to give you a quick application timeline. And here is the actual timeline for the public policy advocacy funding opportunity. You can see the current application is open on June 9th, and it'll close on Thursday, July 23rd at 5 p.m. You'll hear back by August 27th if you'll be continuing to the site visit process. We try to ensure we notify organizations as soon as possible if we do not see you continuing through the process. Most organizations will be notified of their application decision about 5 weeks after the application deadline. For organizations invited to continue in the process, site visits occur in September and October, and organizations will be notified of final awards on November 10th. We recognize this is a long process, and we made this decision for a couple of reasons, but we really want to maximize nonprofit capacity as the majority of applicants here within 5 weeks of their submission. We hope very few organizations will be declined after the site visit process and really want to make sure that we're using your time well. We thank you so much for watching this webinar and look forward to reading your application. Please do reach out with any questions that you might have. And thank you so much for what you do for Colorado's young people and their families.